The insult echoed through the bright emergency room like a slap across the face. The fluorescent lights buzzed overhead as machines beeped and nurses rushed between beds. In the center of the chaos stood a young, quiet nurse frozen in place, her hands trembling slightly as a senior doctor glared at her with pure irritation. His voice cut through the room with brutal sharpness. "Move, B*TCH. For a split second, the entire trauma bay seemed to fall silent. A few nurses exchanged uncomfortable glances. The patient on the stretcher groaned softly. And the quiet nurse everyone had learned to overlook simply lowered her eyes and stepped back. But before the doctor could continue barking orders, a deep, steady voice came from the stretcher. "You don't know her." The words were barely louder than a whisper, but they carried a weight that instantly changed the air in the room. Before we continue this powerful story, take a moment to like the video, comment where you're watching from, share it with someone who believes in kindness, and subscribe to the channel if you believe every person deserves respect and a second chance. The nurse's name was Hannah Carter. She had been working at Westbrook Medical Center in Chicago for almost 6 months, yet most people barely noticed her presence. Hannah wasn't loud or confident like some of the other nurses. She spoke softly, kept her head down, and followed instructions without complaint. To many of the doctors, especially the more arrogant ones, she seemed timid, almost invisible. Dr. Victor Blake was one of those doctors. Brilliant, fast, and incredibly skilled in the trauma room, he had built a reputation as the hospital's star surgeon. But he was also known for his sharp temper and cruel tongue. If someone slowed him down, embarrassed him, or made a mistake, his words could cut deeper than a scalpel. That night, the emergency room had exploded into chaos when paramedics rushed in a critically injured man pulled from a highway crash. The patient had multiple injuries, low blood pressure, and signs of internal bleeding. The man on the stretcher was Lieutenant Marcus Reed, a decorated Navy SEAL. But most people in the room didn't know that yet. As the team prepared for emergency surgery, Dr. Blake had grown increasingly frustrated. Equipment wasn't ready fast enough. A tray had been misplaced. And when Hannah hesitated for half a second while adjusting an 4-line, the doctor's patience snapped. That was when the insult came. Hannah stepped back quietly, her face pale but expression controlled. She had heard worse before. Growing up in a small town in Ohio, she had spent most of her life being the quiet girl people overlooked. Even during nursing school, classmates often assumed she wasn't strong enough for emergency medicine. But they never knew the real reason Hannah stayed so quiet. Because Hannah Carter carried memories that never left her. 3 years earlier, Hannah had served as a volunteer nurse during a humanitarian medical mission overseas. In a region scarred by violence, she had treated wounded civilians, children, and soldiers under conditions that most people could barely imagine. One night, when an attack struck the small field hospital, chaos erupted. Bullets tore through the tents, patients screamed, and medics tried desperately to save lives while explosions shook the ground. That was the night Hannah had met Marcus Reed. He had been leading a small SEAL team sent to evacuate civilians from the area. When the attack started, he had carried injured people out of danger one by one while gunfire erupted around them. But during the evacuation, Marcus himself had been shot. Hannah had been the one who treated him. While the world around them burned and collapsed, she had worked with steady hands, stopping the bleeding and stabilizing him until the helicopter arrived. Marcus never forgot the calm determination in her eyes that night. To him, Hannah Carter wasn't timid. She was fearless. Back in the present, Marcus lay weak on the hospital stretcher, his vision blurry from blood loss. But when he heard the doctor insult the nurse who had once saved his life, something inside him stirred. He forced his head to turn slightly. His eyes found Hannah across the trauma bay. Even after 3 years, he recognized her immediately. "You don't know her," he whispered again. Dr. Blake frowned, clearly annoyed. "Lieutenant, save your strength. We're trying to keep you alive here." But Marcus ignored him. With the faint strength he had left, he pointed weakly toward Hannah. "That nurse saved my life once, under enemy fire." The room went silent. Several nurses turned toward Hannah in surprise. Dr. Blake looked confused, clearly unsure whether the injured soldier was delirious. Marcus continued, his voice thin but determined. "Field Hospital. Syria, 3 years ago. She kept me alive." Hannah's eyes widened slightly as the memories rushed back. For a moment, the trauma room stood still. The same quiet nurse everyone had ignored was suddenly being described as someone who had saved a Navy SEAL in a war zone. Dr. Blake stared at her, his expression shifting from irritation to disbelief. "Is that true?" he asked. Hannah hesitated for a second, uncomfortable with attention. Then she simply nodded once. "I was volunteering there," she said softly. The realization hit the room like a wave. The timid nurse they had overlooked had once worked in conditions far more dangerous than any hospital trauma room. She had treated the wounded under gunfire, explosions, and unimaginable pressure. Suddenly, her quiet nature didn't look like weakness anymore. It looked like strength. Dr. Blake felt something unfamiliar creeping into his chest. Shame. Without another word, he turned back to the surgical team. "Prep for surgery," he ordered. But this time, his voice carried none of the arrogance from earlier. And when Hannah stepped forward to assist again, he didn't stop her. For the next 3 hours, the team fought to save Marcus Reed's life. Blood transfusions were given, damaged tissue repaired, and internal bleeding controlled. Through it all, Hannah remained calm and focused, anticipating every move, handing instruments before the surgeon even asked. Dr. Blake noticed it immediately. Her instincts were sharp. Her hands were steady. Her timing was perfect. The same nurse he had insulted earlier was now the reason the surgery flowed so smoothly. When the final stitch was placed and Marcus's vitals stabilized, a quiet sense of relief filled the operating room. They had saved him. As the team began cleaning up, Dr. Blake slowly removed his gloves and looked toward Hannah. For the first time since she had joined the hospital, he spoke to her without arrogance. "I owe you an apology," he said. The room grew quiet again. "I had no idea who you were, or what you've done." Hannah simply gave a small, gentle smile. "It's okay, doctor," she said softly. Tonight was about saving a life. A few days later, Marcus woke up in the recovery ward. His first question was about the nurse who had helped during surgery. When Hannah walked into his room, his tired face broke into a grateful smile. "You saved me twice now," he said. Hannah laughed quietly. "You SEALs really need to stop getting shot." Both of them knew the truth, though. Some heroes wore uniforms. Others wore scrubs. And sometimes the strongest people in the room were the quietest ones. Before we finish this story, here's a special request. Comment the word respect if you believe every person deserves to be treated with dignity no matter their job or personality. Because sometimes the people we overlook are the ones who have already done the most incredible things. And if this story touched your heart, don't forget to like the video, share it with someone who believes in kindness, and subscribe for more powerful stories like this. You never truly know the strength of a quiet person, until the world finally hears their story. Red Heart.